in an interesting article in regards to aspirin, how aspirin prevents wounds from healing. We're taking minor wounds and making them what's called chronic wounds, or basically a wound that does not heal. What they discovered, and this was published in an abbreviate, the journal, that's a J, of Experimental Medicine, and this was May 2014. They discovered the exact same reason that aspirin prevents blood clots. We look at this, aspirin, good luck reading that too, in blood clots. The exact same thing that causes aspirin that prevents blood clots is the reduction of an enzyme, or should say not an enzyme, a substance called 12-HHT, where 12 help heal this. Now this is how it works. This is how aspirin becomes very bad for wound healing. All right, but the 12-AHT, by lowering this down or bringing it down, it helps stop blood clots. Great, and that's where it helps with heart health. But here's where the caveat comes down to play. This 12-AHT is also responsible, let's take this, you have the epithelial layer of the skin. All right, now you get a wound or an ouchie. And what ends up happening is this wound requires what's called 12-HHT, the exact same that we just had there, to help heal. Because this 12-AHT kind of like sends out the signal to the body to basically call on something called what's called keratinocytes. Because the keratinocytes help heal this. So this 12-HHT is required for these keratinocytes to come to the wound and help heal it. Now if you remember correctly, aspirin, right here, the same thing, it lowers this 12-AHT to prevent the blood clots, but it also lowers the 12-AHT to help heal, or call the keratinocytes to help heal the epithelial layer of the skin. So what ends up occurring is this little minor wound now becomes a chronic wound. It does not heal. The reason that's important, right now you have 6.5 million Americans with chronic wounds. So, what if you could read any of this writing? I apologize, I'm writing kind of fast. So if you could take anything away from this, 6.5 looks like more like G smile. If you could get anything away from this, when discussing with your doctor whether you should be taking aspirin for your heart health to prevent blood clots per se, you have to mention to him that this exact same substance, this aspirin, also stops this 12-AHT, which actually works with an enzyme called BLT2. But it prevents this AHT from being produced, meaning the skin never calls in the keratinocytes to help heal the epithelial cell, meaning this wound becomes chronic, it never goes away. So what you take away, Journal, Experimental Medicine, May 2014. This is how aspirin prevents wounds from healing. Again, 12 help heal this. If you remember, 12-HHT is what aspirin prevents coming to the rescue to heal your skin and fix that owie. Thank you very much. And now on to the next one. Thank you. An aspirin a day, does it keep the doctor away? Well, for women, not so much. Let's review an article that just came out recently called Cons of Regular Low-Dose Aspirin to Stave Off Serious Illness in Women Outweigh Pros. In other words, the British Medical Journal publication of Heart worded it this way: individualized prediction of alternate day aspirin treatment effects on the combined risk of cancer, cardiovascular disease, and gastrointestinal bleeding in healthy women. And this is what happened. You're going to find out it's kind of like a trade-off, but the risks, according to the British Medical Journal, far outweigh any potential benefit. You ready? Here we go. They based their findings on almost 30,000 healthy women who are at least 45 years old and taking part in the Women's Health Study. Participants were randomly assigned to take either 100 milligrams of aspirin or a dummy tablet, a placebo. Thanks for defining that for us. Every other day to see whether aspirin curbed their risk of heart disease, stroke, and cancer. And this is what they discovered. Compared with placebo. This is their words, not mine. Keep that in mind. But don't sue me. Regular aspirin was linked to a lower risk of heart disease, stroke, bowel cancer, and in some women other cancers, but only marginally so. Sounds, marginally so. Well, what's the big deal? Marginally means like nothing. Ready? This is the trade-off, though, for that marginal impact. And this slight health gain was trumped by the prevalence of internal gastrointestinal bleeding, which affected 2/3. That means what? 66 out of 100 would get either gastrointestinal bleeding, peptic ulcers, and sometimes even worse, bleeding on the brain. But here we go. The research says, which would affect 2/3 of women taking the non-steroidal anti-inflammatory drug. The researchers calculate that over 15 years, 29 women would have to take aspirin in order to prevent 1 case of cancer or heart disease or stroke. And you have to remember that's about 3.4%, I would assume, if I did the math right. But they concluded, this is the researchers' terms, that blanket treatment is, their word, ineffective or harmful in the majority of women with regard to the combined risk of cardiovascular disease, cancer, and major gastrointestinal bleeding. This part. And in the British Medical Journal publication of Heart, they concluded it this way. Alternate day use of low-dose aspirin for primary prevention is ineffective or harmful in the majority of women with regard to the combined risk of cardiovascular disease, cancer, and major gastrointestinal bleeding. But they found out the older a person got, the more benefit that seemed to yield with the aspirin. But the problem is, too, also at the same time, more likely you're going to have internal bleeding somewhere that you don't want anywhere, actually. So, in conclusion, aspirin is not a vitamin. No one's ever died of an aspirin deficiency. So, you have to weigh the risk, the benefit. If you believe that 1 out of 29 is a risk worth taking over the age of 65 in this case, then that's your prerogative. But if you feel like bleeding on the inside out, 66% likelihood is not worth it, then that's your prerogative too. Thank you very much once again.
You need Anacin for fast relief. The big difference in Anacin makes a big difference in the way you feel. Minutes after taking Anacin.
Victor has a question for Dr. Martinez. Should I take an aspirin during a heart attack?
It's very important to take an aspirin if you feel like you may be having a heart attack or having symptoms of a heart attack. Aspirin is important because it tends to reduce the likelihood of any of the cells from sticking that can cause clots, which is a very big problem with heart attacks. A common misconception is that Tylenol, ibuprofen, and aspirin are interchangeable, but Tylenol and ibuprofen don't function the same way as aspirin. And if you suspect you may be having a heart attack, taking 4 baby aspirins or a full dose 325 milligram aspirin is important to take.